Hello everyone, I hope you're having an amazing day today. My name is Selma Vale and I am from Ponte Vedra, Florida. I'm a graduate student at Ball State University and I'm currently studying the Applied Behavior Analysis program. I'm enrolled in a SPCE 619 course, Professional Issues in Applied Behavior Analysis, in which me and my fellow classmates are creating an informal debate on the topic of telehealth technology threatening the future of special education and ABA. I will be the introducer for our group during this debate. Our debate will go over the supporting and counter arguments of various different views on telehealth technology that is used in ABA. Me and Arnaldo will be supporting telehealth in its role in special education. Monique and Breanna will be providing the counter arguments against telehealth as a resource in special education and ABA. I'm also going to dive into the role of a summarizer of the debate by providing the background information and factual information about telehealth. Our research for the topic of discussion is the wonderful Monique, who spent many hours researching the internet, finding scholarly articles that support our narratives. Our moderator is Arnaldo, whose role is to act as a neutral participant in a debate or discussion, holding all participants to time limits and keeping us from swaying off topic of the discussion. Our group illustrator is Breanna. She's responsible for creating and finding visual images that hold relevance to the topic of discussion, which is telehealth technology. First thing first, let's discuss what telehealth is and how it works. Telehealth is used throughout healthcare, and it's a tool that allows patients and or clients to stay connected to practitioners and receive many different services, including applied behavior analysis, which is ABA for individuals diagnosed with autism, spectrum disorders, and other developmental disabilities. So, how does telehealth work? Easy. Practitioners use a phone, tablet, or a computer to connect face-to-face with patients or clients using a HIPAA-compliant voice or video platform, providing them with services using technology instead of seeing them in person. ABA services using telehealth have grown in popularity since the COVID-19 pandemic, creating a greater demand for this service because of the convenience and safety factors. Telehealth can improve care, offer convenience, and support sustainability. It can even be used in health education, training, and provider communication. Telehealth has a lot of different pros and cons that our group is about to discuss, and we will look into the ethical aspects of each one that we address. The first topic that we will discuss is the cost associated with telehealth.
Hi, my name is Arnaldo Orozco, and I am going to be discussing the costs associated with telehealth technology providing support arguments with evidence and evidence-based information. All medical and clinical services come with a high price. That is a well-known fact in the United States of America. If you're a parent who has a child who has been diagnosed with autism, ensuring that they receive the best support available for them is more likely to be on the top priority. ABA services, also known as Applied Behavior Analysis Therapy, is extremely helpful for individuals with autism as it helps improve communication, language skills, develop social skills, improve attention, focus, academics, and allow them to learn daily living skills, self-care, all while decreasing problem behaviors. Most children who receive ABA therapy are required to up to 40 hours in ABA in a week in order to get most out of it, and paying for it can be a scary thought. According to the Centers for Disease and Control and Prevention, children with autism can need around $20,000 per year in an extra care compared to neurotypical children to cover all medical appointments, including ABA services. In order to cut down on costs, it's important to remember that ABA services are provided using telehealth technology, are far less expensive in comparison to in-person therapy. Telehealth can reduce the cost of ABA treatment by up to 2/3 when delivered from home, and by almost 1/2 when delivered from a clinic, according to a study by Lindbergh. That is a big deal that makes a world of difference when trying to cut down on cost. In addition, telehealth reduces transportation costs for all individuals involved, BCBAs, ABA therapists, and for the clients by eliminating the need for transportation to and from the clinic. These costs also involve outrageous gas prices and the continuous wear and tear of the vehicle while driving to and from different locations. Implementing telehealth technology also reduces the cost associated with renting an office space, maintenance, cleaning, as well as providing adequate staffing for companies. In comparison, a study was conducted in 2022, which revealed an average saving of over 1,500 pounds per parent for participating in telehealth services, according to an article from Ferguson. These savings include the cost of mileage costs, the cost of travel across projects, equipment, and the cost of BCBA time. Codes that could be useful in showing the benefits of telehealth technology is according to the ethics code in 207, discuss fees, stating that behavior analysis implement fee practices and share fee information in compliance with applicable laws and regulation. Also, they will not misrepresent their fees, as well as in 2.6 discusses the accuracy in billing services and reporting. It holds behavior analysts responsible for identifying their services accordingly and including all required information on reports, bills, invoices, and reimbursements receipts. When in compliance with these codes, it allows the accurate billing. The client will never be scammed when participating in telehealth technology while receiving ABA services.
Hello, my name is Breanna Montgomery. I will be addressing the counter arguments against telehealth as a cost-effective treatment intervention due to barriers in providing treatment. So there is limited evidence, I guess, that I could find regarding the cost of telehealth in terms of like data to approve like implementation, the long-term, short-term usage of telehealth, and so on, and also the consequences of new payment methods using telehealth. Other research articles were mainly in support of telehealth that I found. So the barriers that I did discover were mainly in addressing the funding and security. These hidden costs are simple, but actually have greater impacts to the stakeholder and clients, and as well as the physician, when you think of the short-term and long-term outcomes. So when thinking about that, I also thought about the ethics codes that we have. So there's an ethics code that is 2.19, which mainly focuses on identifying and addressing environmental conditions that may interfere with or prevent services delivery. And I think this is greatly impacts telehealth, because a lot of these companies and other places that you receive telehealth from, you need to have insurances, and depending on how you apply for it or what availability they give you or restrictions they have for telehealth, that really impacts if you would even get services or not. And there's also other barriers too that need to be addressed when you're thinking about telehealth, and I think this code really helps with addressing those, because you still, even though it's telehealth, you still have to follow all the codes. Like, you still have to follow ethics codes, you still have to follow the BCBA codes, the federal and state laws, all those. Another ethics codes that needs to be followed, I think is important, is 2.1 when thinking about cost. And that's thinking about the client's rights and the needs and services, and basing that off of data and scientific evidence, and the outcomes, and how it will protect the clients and stakeholders and from harm. The purchase of equipment brings a lot of other barriers to the stakeholders and caregivers and all the parties in total, which is why I included the depiction of 3 different types of equipment, because even though 90% of the population has iPhones as of 2020, that 10% still needs to be accounted for. So addressing culture, you still need to be addressing cultural barriers and awareness of that, and be culturally responsive to those with diverse needs, because that population may include those who have chronic conditions and so on. Providers also should consider seeking lower to no cost equipment options, and this was based off of Gingell's 2020, including addressing additional considerations on most occasions, the technology usage, like how often people use technology. So the cost of purchasing equipment is such a drawback that even CFOs, chief financial advisors, don't really want to implement it at state hospitals, because the initial investments in the technology and the downstream financial benefits are hard to quantify, and they're not always realized, as is stated by Martel et al. 2020. And this has led to a lack of telehealth being implemented in rural areas and hospitals and so on, because of that cost and attractiveness. So caregivers usually have to come forth with the funding for services outside of their local areas, leading to decreases in benefits from insurance companies. I also talk about this in the accessibility when I talk about Medicare, because they also have decreased their funding, and funding will decrease after December 31st, 2024. So there's also variable in how much funding you'll receive. Additional insurance liability issues are taken on by case, based off of how often you meet with them and other factors. Your physician is where your care is mostly impacted. So all these issues really address funding and how much research you even get from telehealth. Okay, that's my time. Hello, I'm Breanna Montgomery again, and I will be discussing the drawbacks of accessibility in telehealth. A driving factor that I noticed when researching telehealth was that it was so accessible, is what most research articles stated, and that it was very simple. However, I really questioned that, especially after doing research on telehealth, and if that information, like, if telehealth is as accessible as it seems, especially because finding research about it was not as accessible as it seemed as well. So some ethical codes that should be addressed when thinking about telehealth is the cultural responsiveness, as well as 2.03, protecting confidential information, and 2.05, document protection and retention, specifically in terms of storing, transporting, retaining, and destroying physical and electronic documentation related to the professional activities. So telehealth really depends on the businesses and policies that implement the procedure or the usage of telehealth, and the components of telehealth. For instance, collecting data into the medical record system. So how are you collecting data? Data is so important in the ABA field. If you're not collating data, it didn't happen, is what most people say, or at least a common motto in my clinic. And like, if you can't have data, like, most insurances won't approve you for hours as well. So I like, this is very crucial that we understand, like, how is data being, like, retained, like, retained and stored when thinking about telehealth. So I found some research on, like, applications and other things regarding telehealth, and the Commonwealth Fund actually did an investigation about mobile applications. And the study, basically, the results of the study said that 43% of iOS, Apple applications, worked, and only 27% of Android applications were useful for patient care. So 50% of the other applications didn't work. So they weren't able to collect data from those systems. And that is very important for patients and consumers who are paying for these services. Creating value-based reimbursement formulas for future investments. I talked about this earlier too when thinking about the cost, and I still think the cost as well as accessible almost play like hand in hand in this. A common usage of insurance is Medicare. 48 states cover telehealth, although with different restrictions, including the Medicaid programs and Medicare as well. They are typically more restrictive on who they give coverage to, and are more likely to reimburse those who live in rural areas. Reimbursements only in clinical facilities that are in areas in which there is a shortage of health professionals. In 2012, Medicare only spent $5 million, which seems like a lot, but the article stated that's less than their 0.001 expenditures and that was on telehealth services. There's issues also with training clinicians in delivering care. Lehman et al. 22 performed a study where he had two skilled behavior analysts perform just, they had a baseline, and then they had telehealth where they started trying to implement telehealth. I included that graph data also in the presentation. And that just demonstrates a significant decrease in skills when switching to remote teaching, leading to BCBAs receiving further education on telehealth services done remotely. So when they switched services, this also is a detriment to accessibility, because I, or the BCBA, RBT, or whatever, isn't in the person's face. It basically decreases my ability and skills because I can't perform at the same level. I'm not doing DTT at the same level because now it's virtual. And that social aspect is really a drawback too, because now they also don't have the generalization skills that they may not get because they're switching to virtual. the potential to overwhelm clinicians is also a drawback because now you're doing a lot of that background information to get those clients up to the same skills as if they were in person. Um, the usability of telehealth technologies or equipment is very important. Um, they're also like, when thinking about the cost and like codes 2.19, um, the even though like the systems are evolving, the care and like equipment shouldn't evolve. Like I shouldn't have to buy every year a new system. That's another issue of accessibility.
Children strive in safe environments, and they also behave differently in their own home than they would in a clinical setting. One great thing about telehealth technology is that professionals can observe in real time those challenging behaviors that are more likely to occur in a home setting due to the comfortability and spending most of their time in that specific environment. Implementation of ABA techniques inside of the child's comfort zone allows the child to generalize learned skills to everyday situations. Telehealth technology increases the understanding and helps to allow professionals to make adjustments to treatment plans based on the child's individual needs. Telehealth is also a very convenient tool that allows collaborations between multiple team members. ABA professionals can join into the same meeting with speech and occupational therapists to work together on helping children reach their goals and improves clients' overall quality of life. Aside from children feeling more comfortable in their familiar environment, they have access to many effective and highly desired reinforcements in their natural environment than they would have in their clinic setting. Although clinics do their very best on keeping a clean and safe environment for their clients by continuously sanitizing the surrounding areas and items that are being used, telehealth offers a much better approach by completely eliminating the exposure to other people's germs. An ethical code that is used to support this is code 2.10, collaborating with colleagues. Behavior analysts collaborate with colleagues from their own and other professions in the best interest of clients and stakeholders. Behavior analysts address conflicts by compromising when possible and always prioritizing the best interest of the client.
Hello, everyone. My name is Monique, and I will be presenting the counterargument for surrounding environment. In-clinic ABA is far more beneficial to clients than using telehealth technology for providing effective services. The surrounding environment that the clinic offers outweighs the pros that telehealth could ever provide. ABA implemented in clinic settings is just as comfortable for children as their own home. Pairing the child with the environment, many take an extended period of time. However, children are exposed to more peer interaction and opportunities to increase their communication over time and their social skills. Clients are able to have increased social engagement with their BCBAs, other therapists that are not directly working with them, as well as other children who attend the clinic as well. These clients are able to form meaningful relationships and friendships that they would not be able to do if they were confined in their own home. Professionals would gain more instructional control and be able to ensure effective teaching implementation and behavior management, which they would not be able to do using a screen. There are many behavioral challenges that can occur when the client is at home, which the professionals would not be able to manage. The home environment is full of attractions, it's full of noises, siblings, pets, and other comfort items that may distract the client and keep them off task. Client homes may not have the necessary and specialized equipment or the materials that ABA professionals need in order to fully implement therapy and run appropriate treatment goals as well. Another great aspect of having in clinic sessions is the cleanliness of therapy areas. ABA professionals have a greater control of the items that are needed to be sanitized and thrown out or replaced with new materials that are useful for running successful sessions. Some parents have difficulty with the upkeep of cleanliness, including other household chores and responsibilities, and oftentimes don't have the money or access to obtain what is needed and requested from the therapist for the client to be readily accessible.
Caregiving training is an important component of effective treatments for individuals with autism and other developmental disabilities. ABA caregiver training teaches parents and caregivers of the clients the skills needed to help their child's development, improve their functions in natural environments, various coping mechanisms needed for reducing and managing stress levels. Those important skills are guaranteed to make life more enjoyable for everyone involved in the process. Parent-mediated interventions offer the support for treatment to spread across environment generalizations, and it has led to an increased social interaction and communication while decreasing maladaptive behaviors. Caregivers will participate in behavioral skills-based training, techniques that entail modeling procedures and then real-time practice followed by feedback and re-implementation. Much research has been conducted with the similar results that remote training has the same outcomes finding as in-person caregiver training services. The online and applied system of intervention skills is manualized caregivers behavior skills training programs that is delivered using telehealth. This curriculum trains caregivers to use applied behavior analysis with their children who have an autism diagnosis and is greatly improved parental knowledge, improve perceived quality of life, decrease stress, improve caregiver self-efficiency, and as viewed positively by participating families. Caregivers also receive their training through telehealth and have comparable outcomes to those that who have received training in person. In addition, training can also be delivered through telehealth technology, was more cost effective and more convenient to the families that we were in service with. Telehealth allows caregivers to be more actively involved in their child's therapy. Here we have a graph from a study in 2023 showing for feasibility with parental feedback, majority responded well. With acceptability, again, mostly positive reviews. With feedback from trainer, feedback feasibility, again, mostly positive reviews, easy, showing that it was simple to teach and effective. Also with trainer feedback, mostly positive reviews regarding from this study.
What the opposing side was unable to address was the physical challenges that arise when delivering ABA services through telehealth. During the process of providing therapy services, there are challenges that are bound to arise. Examples include difficulty managing high maladaptive behaviors, implementing intervention plans, and gaining instructional control, and so forth. When doing so through telehealth, you run the risk of crossing a line ethically, one being Code 2.10, providing effective treatment. Behavior analysts prioritize clients' rights and needs in service delivery. They provide services that are conceptually consistent with behavioral principles based on scientific evidence and designed to maximize desired outcomes for and protect all client stakeholders, supervisories, and trainees. In order for us as therapists to maintain instructional control through a webcam, we have to have a rapport with not only the client but also the caregiver. Caregivers are going to have some level of difficulty when implementing preventions and intervention programs. However, if the client has some pushback or hesitancy involving a intervention or following through with behavior protocol, the BCBA has the responsibility to modify the behavioral plan so it is effective and able to properly and accurately implement by the caregivers to avoid fidelity of implementation data. Another barrier that telehealth interventions is that it may not work well for children needing more support because of the increased parental burden of supervising the intervention. Issues at the host site and client site concerning client dignity and right to privacy. Uncontrolled access to preferred items could impact the outcomes as well. Ethical issues if the client disrobes during sessions, safety risks to client or caregiver as well. Parents have concerns about the increased burden of supervision during sessions, whereas therapists have concerns about technological challenges and children's ability to sustain attention during remote sessions. Families showed negative effects of the pandemic on children's ASD related behaviors and parents' mental health as well, with greater negative effects evident among children with greater ASD severity, greater cognitive abilities, language, and functional delays. Additionally, parents of children with greater cognitive, functional, and language delays felt that their child would benefit more from online services, thus not providing effective services for the client. But the
The use of telehealth technology in ABA has been an effective way to treat individuals with autism spectrum disorders. It can produce similar and comparable results in-person therapy conducted in clinical settings. There is proven research that telehealth services demonstrates effectiveness, which is crucial. As part of behavior analysts, we must always ensure services are effective in order to be ethical. And recent research from the article, The Effectiveness of Telehealth Direct Therapy for Individuals with Autism Spectrum Disorder, it does state that there were 14 studies combined of total of 248 participants with autism spectrum disorder from the ages of 19 months to adulthood. They were all reviewed. Results from the study were largely positive, suggested that services which were performed telehealth technology, including diagnostic, functional behavior assessments, caregiver implemented services, and caregiver consultation, were equivalent to services that were delivered in person. In the same article, further explains that there were more recent reviews published by Ferguson et al. In 2019, which focused more narrowly on ABA intervention, supervision, caregiver guidance, and delivered via telehealth for individuals with autism spectrum disorder. 28 studies were reviewed with a total of over 300 participants from the ages of 21 months to 16 years. Outcomes showed positive gains in at least one dependent variable for the participants in 100% of reviewed studies, with favorable outcomes across all dependent variables in 61 studies. Both systematic reviews, including studies that focus on delivery and assessments and caregiver guidance via telehealth. Neither review included research implementation of ABA telehealth therapy directly to the patients. However, in another study from Wacker et al. 2013 found that telehealth approach conducted with ABA therapy was as effective to in-person therapy with individuals with ASD, with similar rates of skill acquisition, behavior improvements. Study also found the implementation of telehealth was more cost-effective and more convenient to individuals involved in treatment than in-person therapy. In another study from Mason et al. 2020 provides research conclusions stating that telehealth approaches implementing ABA therapy was effective in reducing challenging behaviors in children, including aggression, SIB, and property destruction. Aligned with Ethic Code 2.1, providing effective treatment, which states that behavior analysts must prioritize client rights and needs of delivery service. They must provide services that are consistent and with behavior principles based on scientific evidence and designed to maximize desired outcomes and protect all client stakeholders, supervisees, trainees, and research participants from harm. They should also implement non-behavioral services with clients only if have required education, formal training, and professional credentials to deliver such services.
Hello, I am Breanna Montgomery. I will be addressing the counter arguments against if telehealth is effective. There are mixed reviews of whether or not telehealth is ineffective in producing long-term benefits, as therapists are no longer within reach to provide one-on-one support. There are many reasons why telehealth, especially in ABA services, would be ineffective in providing the proper therapy services, such as those provided by in-person services. First of all, those most affected by telehealth services would be the clients with higher or more intense problem behaviors. One of the issues with providing telehealth services, those with high or intense problem behaviors, is ability to intervene and provide replacement behavior opportunities, and most rely on caregivers. This was discovered by Rodriguez 2020. BCBA relying on untrained caregivers to physically provide the same therapy programs as a trained BCBA would. BCBA would be able to think critically and quickly in certain situations, where an untrained caregiver would rely on the BCBA to walk them through certain situations. So like role plays. This is especially difficult with clients who are receiving telehealth and maybe younger or have decreased ability to maintain focus for longer periods of time, especially if it's socially maintained. This was discovered by Romney and Stress 2017. The other conditions in which behavior occurs have not been sufficiently researched, is that conducted leading to the assumption that a higher quality of clinical judgment is needed to identify which might be difficult to do remotely. According to the BCBA Ethics Code 2020, as behavior analysts, we should be continuously identifying and addressing environmental factors which could prevent service delivery. While providing virtual services can potentially reach more clients, the quality of services provided is greatly affected. So even though you reaching more people, the ability to provide that services has not deplenished, but is decreased a lot. And this just brings me back to the Ethics Code 219, that you need to address environmental conditions that may interfere with the service delivery, and minimizing other conditions that may be playing a role in your service delivery. There is lack of evidence concerning the drawbacks of telehealth, which I discussed through most of my counter arguments, and its usability within the ABA field. Clinical barriers include the quality of the patient-physician relationship, and telehealth really kind of discredits the relationship, because now it's harder to build trust with the patients, because you're virtual, and now you have to show that you can perform on another level, because now it's switched to virtually. Like, you have to increase your capabilities now, where many people aren't used to doing telehealth as well. I've discussed this before, that it creates shallow relationships based on exchange versus integrating care, and I think that's the main focus of ABA, is that care is supposed to be almost associated with like daily living. But when you have a computer in your screen and you know what time it's going to come, like, it makes it more set up that, like, okay, now that I'm here, now you paid for this, now this is the service, versus like if you were to do it in a daily routine. I've also stated that it reduces the skill. If you can look at the graph, the BCBA skill went down significantly. They also needed 2 years of experience to get back to the same level of skill as when they were performing in person. There's a lot of background information that has to be addressed. Unknown clinician providing care for the patients versus a relationship that has been maintained or continued. Increases fragmentation of care, opens the door for potential abuse, because you're no longer seeing certain like things that you would see if you were doing in person, especially in terms of like self-management and like coping skills, which leads me to inappropriate care, and there's a lot of issues with conflicting recommendations, especially if you have telehealth with different RBTs and stuff. They may give you different informations, and that can really be a detriment to the effectiveness of care, because you're supposed to be having fidelity in your sessions, but you can't show fidelity if one person is delivering care on Monday and the other person is delivering it on Tuesday, and you guys haven't talked. So there is a great need for further research to understand telehealth in terms of delivery of care, and need to show that remote care can improve health outcomes.
This concludes our ethical debate regarding telehealth technology in special education and ABA services. In our final statement, telehealth obviously has various different pros and cons, as well as delivering ABA services across all settings, whether it is implemented in the clinical setting, at home, or even using telehealth. One amazing thing about applied behavior analysis is that it is an individualized approach, and the delivery of services is tailored to that specific client's needs. ABA has never been a one-size-fits-all. We hope that our debate video has been informational to our audience. We hope that you continue learning and making an impact, changing lives in the field of ABA. Have a good day.
What significant changes have you seen since the pandemic regarding virtual therapy services? That's a great question, actually. The significant changes that I've seen since 2020 is that insurance companies have actually expanded their coverage beyond in-person therapy, and they have now been able to cover people who are doing telehealth services and other virtual services for therapy. And virtual services actually rose from 38% to 82 from 2019 to 2020 because there were so many people who were needing therapy services, and so the percentage rose during quarantine. And beyond that, telehealth, the usage of telehealth services have continued to grow even past quarantine as well. Do you think that virtual services such as telehealth provide effective services that allow growth within clients? I think there's always going to be positive and negatives depending on the client, even though I was arguing the counter argument. I do believe that there are some benefits to telehealth services, and depending on the behaviors that the client has. If the client has more maladaptive behaviors and the caregivers are not able to provide effective services due to limitations, then I think the client would benefit more from in-person therapy just because you are giving therapy services to a client more effectively than the caregiver would.
About 5.5 hours of online modules and about 8 hours of video conferencing is necessary for parents to receive appropriate parent training using telehealth to maintain high treatment fidelity. Skills that have been shown to be effectively taught in ABA services using telehealth are functional communication training, social skills, and skills that are taught through discrete trial instruction. Some important ethical considerations that should be made when providing services using telehealth are the family's culture, safety, informed consent, and reliance on scientific evidence when using telehealth.